Hi, welcome to today's Facebook Live podcast show for American Acupuncture Council. My name is Poney Chiang, your host for today, and I'm coming from Toronto, Canada. I'm a continuing education provider and an acupuncture practitioner and herbalist. Today, it is my honor to have the opportunity to interview our special guest for today, Annette Verpillot. Annette is the founder of a company called PosturePro, a health company specializing in restoring the brain-body connection. She's a Canadian entrepreneur, therapist, public speaker, and internationally recognized posture specialist. Annette has developed some of the world's most advanced rehabilitation and injury prevention techniques, and she teaches this method called PosturePro to professionals in various fields. Her unique posture evaluation system is recognized throughout the world for eliminating chronic pain, increasing strength, and improving sports proficiency. Through her teaching, speaking, and research, Annette tackles global health issues and trains professionals to have a lasting impact on clients and patients. Thank you very much for joining us today, Annette.
Thank you so much, Poney, for having me on the show. It's a true honor and pleasure.
Can you tell us where you're joining us from today?
I'm located in Montreal, Canada. You and I are not too far away from each other.
Yeah, it's only 5-7 hours drive, maybe.
Yeah, I prefer taking the plane, but yeah, it's fairly close.
Yeah. So the reason why I wanted to invite you to our show today is that I understand that you have a very special way of addressing posture. And what fascinated me about your method is that you incorporate a lot of application of the understanding the peripheral nervous system, the central nervous system, and even using cranial nerves and as such. Would you be able to tell us how did you become interested? Were you always interested in postural aspects or interested in your neurological things?
Yeah, I come from a family of neurosurgeons that from France moved to Canada at the time when I was much younger. So I was raised in a medical environment where I would always listen to my aunt and uncle talk to my father about the latest in neuroscience. I was always very much interested in the medical field. I recently found a book of myself, a book that they had asked us to draw a picture of yourself or where you saw yourself in the future. And in this book, I wanted to be a surgeon, a neurosurgeon. And I found the picture. It was actually really quite funny. So I've always been, I guess, indirectly involved, not really realizing it in the world of neuroscience through my, of course, through my family. But at the same time, I was always very much involved in movement in sports, and very quickly became aware of the aspect of movement and performance, and of course injury, because I could remember my father saying to me, you at the time I made it to the Quebec Olympics, and he just basically said to the Games of Quebec, excuse me, and he was like, you can't go to this because the ultimate goal is for you to make it to the Olympics. This is how it starts, and by the age of 30 your body will be ruined. And I remember not being very sad about this because he literally interrupted the whole process. But now that I think back, I guess the myth of movement and training and athleticism and injury go hand in hand.
May I ask, what was your area of focus, specialization in sports?
The 100-meter sprint was my specialty. No one can catch me. I was
just very impressive. So can you tell us, I know it's a very diverse and broad and in-depth topic. Can you tell us a little bit about PosturePro?
Yeah, so PosturePro opened its doors in 2004. The idea was to combine training with rehabilitation. At the time, I had studied different types of rehabilitation therapies to be able to accommodate my clients. I myself went through some injuries while I was training. I've always, been involved in fitness and trainings as far as I can remember. And for me, it was something that was very important to be able to try to address injury. So of course, I naturally learned rehabilitation methods and techniques to be able to apply them with my clients in practice. Very quickly realized that working manually was only providing temporary results, not really understanding why that was actually happening, and kind of following the flow that everybody does. You know, they teach us to do A, B, C, D when you find that there's different types of local problems. But I guess that part of the problem that eventually I came to realize was that they were not really telling us why the problem existed to begin with. So the cause behind the symptoms that we are taught to manage. So, you know, a quick Google search kind of got me going on the way, and then associating myself with different professionals and specialists in their fields, really some of the best in their field as far as rehabilitation, to try to combine all of this knowledge together to create what we call today the PosturePro method.
Can you tell us a little bit about some the approach or the rationale in it? Like, how is it different, or what makes it more effective, for example?
Yeah, so combining the knowledge of neuroscience and biomechanics and movement all together, but also the knowledge of how the brain develops in the first place in human beings, and working with a method that allows us to kind of connect which brain body connection parts are broken is what I find makes our method unique. We work on what we call specific sensory receptors. Yes, we do work with the eyes, obviously the cranial nerves that innervate the eyes, but where I think our strength lies is in all the links that we make within those different cranial nerves and the symptoms that we're seeing in clinic with our clients, but also the fact that we address one component that I think is the missing link in most therapies, which is the weight-bearing surfaces of the clients that we're working with. We never really take into account, I mean, in North America, when we talk about the feet, we tend to think of feet specialists or podiatrists, but in reality, what we're looking for is the way that this person learned how to walk in the first stages of their lives, which we know is you know, ultimately between 0 to 12 months of life, and the postural strategies then that the clients will then develop, and the links between the symptoms that they're presently experiencing, the posture that they have today, and the brain connection, or the broken brain connection, if I may say, that they are living with, which are creating the symptoms that we are seeing in our practice on a daily basis. And this holds true for children as well as adults.
So there's a lot of emphasis on the information inputs coming from the feet. You mentioned about the vision. What are some of the other important inputs that you take the time to assess or provide exercises for?
Yeah, so another really interesting link is the position of the mandible, the position of the jaw, and how the actual stomatognatic system will develop, how the motor act, the tongue posture, if you wish, nasal breathing, all of that complex has the potential to influence head posture, position of the head on the shoulders, which will challenge our center of gravity, right? The ultimate goal for us, what makes us human as humans, is the fact that we're bipedal, and fighting this, you know, we're constantly fighting against gravity, and how we fight gravity ultimately will dictate how much energy we have throughout our day. So, for example, someone who has what dentists call a class 2 occlusion, which is where the upper teeth of the maxillary will cover the lower teeth by more than 1/3, this will bring about, how can I say, the mandible will move up and back, pushing the head forward. And this would be a permanent state of disequilibrium that the client would be living with, which, you know, we can very easily imagine how this can cause lower back pain. But there's also missing teeth, there's also tongue posture, and there's also many other links that could be made within the TMJ in itself. As well, we work with pathological scars. This is any type of surgical intervention that someone may have had. We treat it with either essential oils or with laser therapy. Would love to learn about acupuncture. I know that acupuncture is absolutely phenomenal when it comes to pathological scars, but where we try to make the link is again with the symptoms that the client is experiencing, and whether or not the scar is actually creating a postural, a muscular imbalance in the context of the session.
It's very interesting. So you mentioned the tongue posture. Most of our listeners are acupuncturists, and we actually really love to diagnose each other's tongue and our patients' tongues. I think they would be very interested to be able to add a dimension of postural analysis from the tongue. You also talked about equilibrium. I was wondering if the vestibular or the ears come into play in this system, or it's more focused on the jaws and other inputs.
No, we do absolutely consider the vestibular ocular reflex, but what we tend to see is when we actually realign someone's posture by working on their feet. We really always start with the two extremities, the sole of the feet, the eyes. Is there anything going on with the jaw? If there is, we must neutralize it. We like to work by process of elimination. What's causing what? Is it the feet? Is it the eyes? But we know that ultimately all of these sensory receptors together would have the potential to affect our posture and our stability. So what we're going to try to basically, what we're going to try to determine is is the client clenching even? That could even be, are they excessively stressed? We know that stress is psycho-emotional. When I'm stressed, I'm going to clench my teeth, but some clients are doing this, or patients are doing this on a daily basis and are not fully aware of the negative impacts that this can have not only on their posture, on their hormone production, but on their, on all of the different physiological systems of the body, really.
Right. Fascinating. That's definitely something, tension and clenching and the tight muscles of mastication, temporalis muscles. Those are actually a lot of things that acupuncturists see on a daily basis. So I think there's definitely a lot of opportunity for an acupuncturist to employ some of this diagnostics, perhaps even use that to not just reduce the stress and the pain, but actually improve posture from that. Do you, as you know, acupuncturist is kind of well known for treating pain, and now there's actually more of a movement in the acupuncture community where we're trying to start to use acupuncture to affect neurological issues. So Parkinson's diseases and stroke rehabilitation. And obviously there's a lot of gait problems in these individuals, postural problems in these individuals. So that's really why I became interested in your work. Could you help our fellow listeners understand how might your work, or being an expert in posturology, make them better at what they're doing?
Yeah, well, as you know, meridians is kind of like an energy highway that flows within our body. And if we look at the way that someone's posture has developed, and I put the emphasis on this because understanding how someone developed their postural strategies from the get-go is a really important factor in determining where they are at today. So I'm not an acupuncturist, but it's very easy to imagine and understand if someone has a forward displacement of their center of gravity, a lower shoulder, a rotated pelvis, vertebrae that are in a subluxed state 24/7, poor body posture in that context, can poor body posture affect the energy flow within our body? We know that it can affect our many other factors, from our sympathetic to parasympathetic, to our circadian cycle, digestion, blood flow, stress, and of course, energy within our body. So I think there would be many benefits of incorporating the PosturePro method with any type of therapy, but also meridian therapy and acupuncture, because it will simply just enhance and double the therapeutic effect. If someone's posture is better aligned, you're actually giving them the chance to be able to fully recuperate and tap into that healing process that they have within themselves, and of course the natural flow of energy that we all have within us.
Mm-hmm. I'm just going to sprinkle a little bit of Chinese medicine terms for the benefit of our listeners. For us, we talk about points around the neck that are called window to the sky points. These points directly affect psycho-emotional presence and awareness and health. So imagine how problems in your neck can actually cause psycho-emotional issues. For acupuncturists thinking in terms of those points along the spine called the back shoe points, which affect individual organs. So if you are having subluxations or you're having abnormal curvatures, it would affect the energy aspect of the bladder meridian or affect those back shoe points, and they can actually cause internal somatovisceral problems. So I think knowledge of this posture analysis comes hand in hand with acupuncture, and I think there's a lot of things to be excited about how we can actually combine these knowledge to actually improve our ability to help patients, both physically as a postural aspect, but also internal viscerally, because after all, the nervous system is the commander in chief that controls all of our autonomic systems also.
Poney, if I may just add to what you just said, I very much appreciate the description that you just gave. So within this complex, as we know, and again from the method that we're working with, if there is a crossbite, for example, or poor breathing habits that have been acquired since the beginning of life, or eyes that are not tracking properly through the cranial nerves within the brainstem, we know that these two components alone can affect the stability of our suboccipitals and C1 and C2, which hence can this have an impact on the energy flow? And as you've just explained, my guess is that it can. So if we're starting from the perspective that you can't build a house on a crooked foundation, so trying to align structure as quickly and as fast and as best as possible, 24 hours a day, 7 days a week. So this work is actually being done without you having to think about it when you work with a brain-based approach, and then incorporating any other types of therapy like acupuncture is always at a greater benefit to the patient.
Yeah. What you just mentioned gave me a couple more ideas I want to share with our listeners. Eyes, for Chinese medicine practitioners, have very much to do with the liver and has to do something called wind and movement. So isn't it interesting that by analyzing eye movement, which we are basically looking at its connection to the liver and wind, so you can see how there's a lot to the ancient teachings about how eyes have to do with wind, because by analyzing eye movement, you have an indirect ability to assess the nervous system, which a lot of nervous problems are due to wind, but also relationship to coming and going and movement issues. Tongue, look again, back to the eyes. Eyes are supposed to be where the spirits or from the Shen emanates. So you can have added tools to assess the patient's state of Shen and spirit. Their tongue is supposed to be the opening of the heart. And so by looking at the tongue posture, you have an indirect way of gauge into the Chinese medicine state of the heart's health. So these are all, the thing is really, really fascinating. And I'm really looking forward to learning more about this from you. Now, I know you have a lot of experience working with athletes, working with people with chronic pain, and even children and developmental problems, people with central nervous system problems. And I would love to hear all your experience, but because of the limitation of time we have today, could you just share with us with one maybe from recently that you've seen that was really highlighted the power of this method, something that's really meant a lot to you personally as a therapist, you're really able to transform somebody, or something just really neat, something that's very cool that even surprised you for so many years of practice. Just a story. Basically, tell us a story. We want a nice story.
Oh, I have many stories to tell you. What I love about the PosturePro method is that there's not a week that goes by where I don't have shivers on my arms, because we realize that we're actually changing the lives of people. And when I say we like to use the hashtag changing lives, is when you give someone the ability to be able to regain their pain-free living and live a life free of pain so that they can enjoy their lives. Mm-hmm. That for me is the ultimate reward. The case that I could think of, the first case that I sat on for a long time was when I got contacted by someone called Diane Murphy, and this is going back maybe over 10 years. And she left a message at PosturePro saying, I've just recently been diagnosed with Parkinson's disease, stage 1. I've tried everything. I'm desperate. Please, can you help? And this was really the first case of Parkinson's disease that I would have to, that I would ever encounter in my practice. And not knowing how far I can actually push the nervous system and really being afraid of the unknown, I didn't respond to her call for 3 weeks. After the 3rd week, I said to myself, Annette, this is silly. Face your fears. The worst thing that can happen is that nothing happens, and so be it, but at least try. And I did try, and I've put the video on my YouTube channel of that first consultation originally. Well, obviously the full consultation was recorded, but we trimmed it down to 5 to 6 minutes. Was the most rewarding moment that I ever had. I mean, you could hear Diane saying how her entire symptoms in the session are completely disappearing. And funny enough, what did it the most for her was a scar that she had in her lower back. So we proceeded in correcting the foot. We worked with the eyes. We actually looked at the jaw. We're going through this in the video. We're going through this step by step as we're explaining what's happening. But what really worked for her was, so we had to do all of that first. And then lastly, we looked at the scar. I said to her, Diane, do you have any scars? And she goes, yes, I had lower back surgery years ago. And just by working on the scar, she was like, her testimonial was overwhelming. I mean, I could not express it more, how she was so verbal and expressive. So that was really one of the most ooha moments for me in my practice. And I'm lucky enough to say that these moments have followed and continue to follow every week of my life and in practice here. So this is, again, I'm so grateful to be on your podcast, because my ultimately, I think that everyone should have the right to know what is out there and choose the best therapy treatment for themselves and for their loved ones, really.
Thank you. This is a great, very heartfelt story. Unfortunately, due to time limitations, we have to wrap up real soon. Could you give us a little appetizer, or like a little bit of amuse-bouche, a little bit of teaser, something that, if it's, I don't know, it's very complicated if it's even possible, but something that is like a little technique or something like that we might start to incorporate and to get us to see the power of posturology?
Yeah, so doing simple eye exercises, as I demonstrated in my TED Talk, which consists of doing simple circles and trying to converge, trying to focus on a specific target as your eyes are moving in 360 degrees. Some people find that very challenging. If they feel dizzy while they're doing it, simply, just pull away the finger and continue doing those eye exercises. This is a great way to start working out your eyes on a daily basis. And quite frankly, I think it should be incorporated in for everyone, regardless of the context. I think everyone should work out their eyes in the morning when they wake up. I think I'll also add to that, being aware of whether or not you clench your teeth. I love to have people become aware, just become awareness of whether or not the teeth are in constant contact by putting red dots on the wall. And when you see the dot, in that moment, you will say to yourself, are my teeth touching? And if they are, simply taking a moment to just stop whatever you're doing. If you can, position your tongue on top of your palate, hold it there with your lips closed, and breathe for 1 minute. I think that doing those two things already is a great way to calm your parasympathetic, your sympathetic system down, tap into parasympathetic, give yourself a break, disconnect. And of course, if you retrain your eyes, you're also retraining your muscular system.
Thank you very much. So if people out there would like to learn more about your methods and your teachings, where can we go to find out more about this information?
Yes, our website is posturepro.co, and we're very active on social media. We post daily tips and specifically before and after cases on our Instagram channel, which you can find us very easily at PosturePro. Same address for Facebook.
Great. Thank you very much for joining us today. It was being an absolute pleasure.
Thank you so much.
Yeah,
Poney, it was a pleasure meeting you.
Look forward to studying with you soon in the very near future.
God bless.
Thank you.
Bye-bye.
Bye.